In 2022, over 61,000 road traffic accidents involved men under 49. They account for 75% of all fatalities. They are also 3 times more likely to take part in high-risk activities, which cause major traumatic injuries. University Hospital Coventry Trauma Team are on standby for one such case. 44-year-old male crash-landed a paramotor 30 miles from the hospital. Difficult road access. Helicopter medical services dispatched.
So this is Roger. He's a 44-year-old male who at about 20 past 10 fell from a paraglider while he was coming into land. He has been GCS 15 with us the whole time, but there's a bruise on the front of his head and complaining significantly of pain in his right leg.
So I'm just going to quickly check you top to toe, check how you're doing.
In general, because of the nature of the trauma, we are concerned about his entire body.
You've got good air entry to the left face. And a quick feel of your tummy, Roger.
Right now, we've managed to do a primary survey on him. We've identified the injuries of concern. There's an open injury around the tibia and fibula area, that's the lower leg, so he's had some antibiotics for that as well. Well done. All done now, okay? Yeah.
You're in Coventry Hospital, okay, because you came in as a trauma.
Roger works as a paramedic, but today he's the one being treated.
So there's a break in the upper portion of the femur there, and there's also a break in the right side of the pelvis, and it extends all the way down towards the hip joint on the right side. So it's quite severe injuries, to be honest. Trying to load some more. Yeah. Okay. Roger?
Yes.
How are you feeling?
Pain.
Pain. Do you understand what's happened?
Yes. I fell out of the sky.
Okay.
What happens when a body collides with a hard surface? If traveling at violent speeds, it can cause fatality or catastrophic trauma to the spine or the head. But landing feet first will absorb the force through the lower limbs, causing potentially life-changing injuries, but a better chance of survival.
So basically...
Is my phone around?
I haven't had a look for that because I was more concerned about your injuries, I'm afraid.
Yes.
I'm so sorry.
Yeah, fine.
We'll have a look to see if there's a phone that was brought in.
So the only thing we got that I found off of him was his wedding ring, his watch and his necklace.
Okay.
I don't think you're going to be paramedicing for a little while.
She's going to be so annoyed.
I'm assuming you're on about your girlfriend.
Mm-hmm.
I got a message from the doctor, Hem's doctor, who brought you in.
Right.
She's on the way.
Oh dear. Huh.
You're going to be in trouble.
Yep. Supposed to be going to Tenerife in
Oh dear.
middle of July.
No comment.
Yep. Uh-oh. Oh. Hi, honey.
You're right, my name's Tom, one of the staff members here. You've got Andrew, the doctor, over there.
Hello, you all right?
And you've got the young lad who's in trouble in the bed.
Very much so.
Hi.
Hi, dear.
This just 1 milligram at a time. Oh.
Have some ketamine, have you?
They gave me
A lot. Well, it stopped you screaming anyway. I'm going to sell you stuff.
No.
You all right?
No.
I had a phone call and I just thought he was joking to start off with. I didn't really know what his injuries were, and I know what could happen if you like fracture your pelvis. Obviously, you can lose your whole blood supply into it. So
Yeah, I wasn't too sure kind of what the condition he was going to be in when I got here.
He's had 20 milligrams of ketamine.
Oh, nice!
You stupid sport.
Roger, 44, crash-landed paramotor. Sustained serious injuries to his thigh bone and pelvis. Faces a double procedure.
So we've got to open up the front bit of his pelvis, and because he's got good bone, he's a young guy, we'll be able to hopefully hold that just with a couple of screws. He's got his femoral fracture, which is going to be a bit more challenging because it's in lots of bits. It's very displaced, which Mr. Ramitar is going to come in and give Ed a hand with.
Trauma is unpredictable. It can range from a road traffic accident to someone falling from a height, be it a building, be it someone who's parachuting. We have to be able to think on our feet to respond to what's in front of us. You can then deal with individual injuries and broken bones and things like that. Quick decisions are needed to save a patient's life.
So you can see the fracture there, yeah?
Using X-ray images, the surgeon can try to realign the broken-off piece and secure it into place using clamps.
Yeah, well, that looks nice, doesn't it? It looks in good position. And yeah, why don't we go the cannulated screw now?
2 screws must be drilled in at just the right angle to go through each end of the fractured-off wing, back into the pelvis to secure it. A complex task when the bone is so fragile.
Sometimes, you know, if you hold the pelvis up to the light, you can see light through it. You know, it's so thin, the iliac wing. But yeah, I haven't really got a perfect view for looking at the crest. But I think the best thing is just to do it on feel, isn't it? And know that I'm on a cortex. That's cool, thank you.
If the screws miss, it could cause greater damage and impact Roger's ability to walk.
So we can just use this like a drill. If I can get an angle, get this to dig in there. Can we have X-ray back in? Everybody's still covered? Yeah. To pelvic surgeons, that looks very satisfying. He's going to end up with a fair bit of pain in the recovery period, unfortunately, but we'd hope he'd have good function eventually, but it'll never quite be the same again.
Great Britain, 340 collisions a day. 1 every 4 minutes. University Hospital Coventry has specialist surgeons on standby to tackle anything that comes in. Roger, 44. Sustained a fractured pelvis and broken thigh bone, crash landing his paramotor.
Good luck with his femur, mate. He's got a great bone.
Team 2 have arrived to try and mend his complicated leg break.
So the plan is we're going to reduce, get the bones in the right position, and use a long nail, a rod, to fix his femur. The tricky bit is going to be he's very swollen, the bone's in quite a few pieces, so it's going to be quite challenging. Good, all right. Let's get this fracture reduced out and then let's get this nail down. All right, guys, we're going.
Starting.
Very muscular, isn't it? It is very muscular. So that piece needs to key into there, so this just needs to be rotated a bit like that. Okay.
It requires physical strength to try to pull the leg back into its correct position.
We're trying to reduce the fracture, i.e. get it back aligned. But the difficulty is that it's quite a comminuted fracture. It's in multiple bits, and he's very muscular. So getting access is very difficult. Watson, okay. I'm going to give you a bit of traction, okay? Go. Okay? We just need to get this bit of bone on the other side of the sacrum. Okay, 1 second. Ready? So I'm just leaning the top one back, because if you can see it, and then let me try to rotate it. Go. Okay, almost there. All right. I'll be honest. Alignment looks good. All right, come on in with X-ray, please.
To hold the fragments in place, they drill a guide wire through the centre of the bone to act as a pathfinder for the metal rod. X-ray images are taken for accuracy.
Okay, stop, come down to the knee. A bit more down to the knee. And flash. Okay, all right, bigger remote, keep the thing guide wire in.
The metal rod is hammered down the canal of the thigh bone. But with the pieces precariously held together, they must take care not to blow the break apart or fracture it further.
Okay, so we managed to get the fracture aligned as best as possible. We've gotten a rod from the top to the bottom to hold it in place. So what we're doing is putting the screws at the end of the nail to lock it on both sides. And then we'll do a little bit more work at the fracture just to hold some of the fragments together. X-ray, go again. Yep, save that one for us, beautiful. All right, so we're in a home stretch now. We're just closing up, but he's likely to need a second trip to theatre for his leg wound. And we'll obviously we'll monitor and see how his femoral fracture and his pelvic fractures heal up. We're finished with X-ray, yes. Thank you very much for your help, thank you.
Roger's treatment isn't over. The plastics team will attempt to repair the open laceration to his calf in a few days.
I'm going to give you a bit of traction, okay? Go.
Roger had surgery to fix his fractured pelvis and broken thigh bone. The paramotor laceration to his calf is so severe, just stitching it won't be enough. Plastic surgeons will perform a skin graft to try to repair the damage. Skin grafts can be done for people who've skidded on the ground and had their skin torn away from the body. Healthy skin is taken from one area and attached to the injured part in the hope that it heals.
Right, so we're going to give you a bit of oxygen to breathe. Actually, Jamie, can sometimes feel a bit cold going up your arm. Occasionally you can be a bit stinging.
What we're planning to do for coverage of the defects to the lower calf is we take an actual thin piece of skin from the thigh and we transfer that down to the calf.
The injured site is prepared for the new graft. A template is used to work out how much skin they need to cover the exposed area.
See roughly what size.
Okay.
Using a dermatome machine, they shave off a healthy layer of skin from Roger's thigh to place over the open laceration.
There are different depths we can go to based on the setting on the dermatome. We sort of went for a slightly thicker skin graft just because of the areas exposed.
So you can see just these tiny kind of speckles of blood coming now, which tells us that it is just the correct depth.
That dressing remains untouched for a couple of weeks to allow the skin cells to grow back, and there's enough remaining in there to regenerate.
In order to make this go a little bit further, we can put the graft through a device which puts in lots of tiny holes in it, and that just not only does it let any fluid or kind of bleeding seep out, but it also means that it can cover a larger area.
It's crucial the laceration is fully covered for protection from bacteria and to prevent infection.
There are lots of actual ways that a graft might not work. It might just not take, and take means that it actually takes up the blood supply from the tissues, and it can actually partially take, and if that happens, we might even need to do the whole thing all over.
After an accident, bony injuries or fractures may be relatively easy to treat. However, soft tissue damage may not only be a physical thing, but also a psychological thing, because even after we've treated the patient, they're still left with scars after the injury, the scar acting as a constant reminder for them of the trauma that they have been through. So the goal in theatre is to achieve the best possible functional and aesthetic outcome for each individual patient.
Morning. Hi, morning, Roger. My name's Sunita for the plastic surgery team. Nice to meet you this morning.
6 days on, they are checking to see if the graft has worked.
You right?
It's a lot of dressing. This is the first time I've seen my leg full stop, actually.
If you can just roll over to your side, and as you go, I'll take that's it. Up, perfect. Well done, well done. This is just the last bit, my darling. You don't want to cause them any more harm or any more pain. Right, Mohammed, we're just going to have to get the dressing straight on it. It's not just about the injury, it's about their well-being and their emotional feelings and psychological as well. So we're trying to support all round. And down, and relax. Well done, well done, well done. So we will say that's 100% taken. Just needs to be a bit more firm, but it is the first graft check, so it's looking good.
They're happy with where it's at, given its duration, but they are not happy enough to say yes, kind of, you know, go home. Not really too concerned about that as long as the healing goes well and I can get back to what I was doing.
Roger's traumatic crash landing caused catastrophic injuries to his leg and pelvis.
Okay.
The physiotherapy team want to get him back on his feet.
You can try and reach up to the handles. That's it.
Good. Ready?
Big stand. Oh. That's it. That's it. Okay. Okay, right, we're going to move forward now.
Okay.
Good. That's it.
Good.
So he struggled to bend his leg and struggled to clear the floor, which is why it was so hard for him to walk. So if you can try and bend that knee a little bit to try and give yourself some space between your foot and the floor, then you can walk. That's it. Breathe. That's it.
In road traffic accidents and any collision, people can sustain not just life-threatening, but life-changing injuries. These trauma cases, it's not just about broken bones. There can be damage to major structures, soft tissue damage, and even when we fix the bones, it's months to years of rehab for them to recover. There's still no guarantee that these patients will return to normal function.
Right, now weight onto your left. That's it. That's it. Good,
That's it.
good. He's very lucky to have only come off with the lower limb injury. He could have come off it much worse. He could have lost his life.
Stand up from there.
Nice and steady, okay?
Roger's had 2 weeks of rehabilitation, and the plastics team are happy with the progress of his skin graft.
It looks really good.
Today, he's going home.
Getting there slowly, a long way to go, but definitely looking forward to getting home. Although I've not seen my little bell arrive yet that I ring for assistance.
And nor will you.
And nor shall I. Yes, so...
That's for sure.
Yeah.
He's very lucky. It could have quite easily been, you know, his spine that he fractured. It could have, you know, been both legs. Could have been his chest, could have been his head. So the fact that actually he's still here, a bit of a miracle, really. He's so determined. He's so determined to come home, though. But just I do have some concerns that might be a little bit too soon getting around.
You right?
The next couple of weeks, I think, is going to pose quite a few challenges. Learning to cope at home. It's one thing asking the nurses and the doctors that are in the department for help with little things. I think asking Rachel and, you know, other people that are around, I think that's going to be a little bit more challenging. So hopefully they will have some patience with me. But I'm looking forward to it.
Might be a long journey home.
Cheers, guys. Thank you very much.
Sunshine. Look, this is what outside looks like.
So, the big question, will I continue flying or not? I know what Rachel thinks to it. It's something that I would have to have a serious think about. Shall have to find the crew that came and go and see them at some point and say thank you.